Lesson 10: Gene Therapy. By the end of this lesson, you should be able to consider whether gene therapy could stop diseases being passed on to the next generation, and explain how gene therapy could relieve the symptoms of inherited diseases like cancer. Gene therapy is a new way of treating human disease. Some human diseases are caused by faulty genes, such as cystic fibrosis and hemophilia. The aim of gene therapy is to replace the faulty gene with one that works properly. It is hoped this will cure the disease. This technique is still at the experimental stage. One hope is that gene therapy could stop diseases from being passed on through inheritance. The gene could be inserted into a patient's reproductive cells. After that, it would need to be incorporated into the chromosomes. The patient could then pass the introduced gene onto their offspring. This procedure is particularly difficult. It has not yet been tried on humans. One problem is that once the gene is introduced into the reproductive cells, it will continue to be passed on to future generations. These generations would have had no choice in receiving the therapy. Another concern is that any long-term risks from this therapy are not yet known. Most researchers are working on the potential of gene therapy to treat patients currently suffering from disease. Some cancers are caused by faulty genes. It may soon be possible to treat some of these cancers by inserting genes into the cancer cells to make them more sensitive to treatments such as chemotherapy, inserting genes into cancer cells that make a toxin and then activating them to kill the cells, using genes to stop cancer cells from making new blood vessels, which prevents the tumor from growing, introducing genes into cancer cells so that the body's immune system identifies them as a danger and destroys them, inserting genes into normal cells so they can better withstand the side effects of treatment by radiotherapy and chemotherapy. This can reduce the patient's suffering and also make it possible to deliver higher doses of the treatments. There are many difficulties to solve if gene therapy is to be successful. Targeting a gene to the correct cells is very important. If the gene is inserted into the wrong cells, the patient could have health problems. If the gene is accidentally inserted into reproductive cells, it could be passed on to the offspring. The patient may also have an immune reaction to the virus used to deliver the new gene. In addition, many cells divide rapidly, so the new gene may not live in the body for very long. Patients may need many rounds of therapy.